I don't really want to do this. Well, I do, but... Hi everyone, this is Herb and I am a hospital pharmacist based out of British Columbia, Canada, and my focus is in cardiology. I'm also a father of 2 young kids, and I'm starting this YouTube channel because I think that there could be a lot of value to it for myself and others. I've come up with several reasons for me to start this. First one being I need to start taking breaks at work. This is a bit of an outlet for me, even though it's kind of still work related. But I'm going to do it on my break time if I'm in my office. Number 2 is that I'm finding that I'm becoming more and more forgetful these days. Whether it's an age thing or just possibly not using my brain as much as I probably could and communicating with people in an effective way that I think I could probably force myself to do more so by doing these videos. Third is that I get a lot of questions from a lot of nurses, doctors, and pharmacist colleagues who have questions about very specific cardiac medication type issues. And I hope that I'll be able to share some practical clinical tips and pearls with you as sort of the heart pharmacist specialist in this hospital. Number 4 is that I want to use this as a platform for me to keep myself up to date with whatever's happening in the cardiology/pharmacy realm, and I hope that I can keep up with the new drugs that come to the market. I'm finding that over the last few years there have been several, and I probably don't know them to the extent that I would like to know them at. So I'm hoping that in this series I'll be able to get a better grasp of it, and if I could teach it, then hopefully I will know it better. Number 5 is I hope that I'll be able to improve my public speaking skills, as over the last, like 5-6 years, I haven't actually given a whole lot of talks for any organizations because of, say, COVID or having 2 young toddlers. I've been focusing most of my attention and time towards them. This is a means for me to practice some of those things and hopefully get better at them, the public speaking skills. Number 6, I hope that over a long period of time I'll be able to curate a series of these videos that could be useful to you, is either a nurse, a patient, a doctor, or a colleague pharmacist. And I get a lot of learners who come through this hospital on rotations for their programs, and I want to be able to serve as a role model, whether it's an actual live role model or somebody virtual. And with technology nowadays is that everything seems to be kind of shifting more towards either social media or video format. And a lot of the messaging that comes out from either medications or trends or things like Ozempic or whatever kind of go through the video format anyway. So I want to be able to sort of create a YouTube identity where I can sort of maybe even eventually help them create their own sort of YouTube platform for something of their particular interest. These are intended to be like casual conversations that will happen either in my office, where sometimes you may hear the occasional code blue, code red, or code white, and hopefully not a code brown. Or they may be conversations in my home office at the end of the day when the kids are put to bed, or early morning before my kids get up. I haven't decided. It could be either on a walk when I'm going out for a quick little stroll around the hospital on my lunch break, or it may be a presentation I've come up with that I'm walking through. I haven't decided exactly what I'm going to do, but this is a platform for me to share some of those things. And last but not least, it's kind of morbid, but we're all going to die one day. And I kind of want something that either the pharmacy or cardiology community can sort of remember me by, and patients as well, either my clinical tips or pearls, or quirky mannerisms, and something that maybe my kids will also be able to watch and remember me by in a capacity that they probably wouldn't have known. Last but not least, as a quick disclaimer, please, if you're a patient or whatnot, don't use this as medical advice. If you have issues pertaining to your own health, please seek medical attention by your healthcare provider. These tips and pearls are mostly for educational purposes and should not direct your care in any way. So appreciate you all for tuning in. This is sort of my intro video where I'm going to try to come out of my shell and share with you the life of a cardiology hospital pharmacist in acute care. And I just wanted to say again, thank you all for tuning in, and I am very grateful that you've watched till the end of this video. And if you want to see more of these videos, please hit the subscribe button and share this video with anybody who think it might benefit from this. And until next time, thank you all for watching, and we'll see you in the next one. Stay safe. Oh, and say no to drugs. And that's no with a K-N-O-W. Say no to drugs.